Welcome to Under the Hood with Dr. Alex and Dr. Rebecca,
where we share pearls of wisdom from our 30 years of combined clinical experience. Good morning.
Good
Good morning.
One of our favorite people is joining us today as a guest to discuss a very hot topic right now, and that is Alyssa, who we're going to discuss endometriosis with. Alyssa is a pelvic floor physical therapist, and she has her own endometriosis journey to share with us today. So, Alyssa, thank you so much for being with us.
Yeah, really.
Thank you so much for having me. I feel like perfect timing too in March with Endometriosis Awareness Month. So
That's right.
it's very timely.
And also so many new guidelines coming out about diagnostic criteria.
Yes, which is very exciting to see.
And less invasive.
Yes, exactly. Yeah.
Why don't you tell us a little bit about your own journey with diagnosis?
Yeah. So I was officially diagnosed in 2023, right after I finished graduate school for physical therapy. You know, as so many people have had this experience, that was not when my journey actually started.
Of course not.
I would say my journey really started when I got my first period. So I was probably about, 13 at the time. So it took about a good 10 years to actually get to that diagnosis. For me, I have always dealt with a lot of the very classic symptoms of endometriosis, which is also kind of like goes to show that like even someone who is just presenting so classic endometriosis can take a really long time to get in front of the right people to get that diagnosis.
That's right. It took an average of 10 years for someone to get an
Yeah,
diagnosis.
which is really unfortunate because that 10 years can really take a toll on a person, physically and mentally. And you can feel like you're going a little bit crazy because you're not sure what is wrong with you. But I think that for me, like the eye-opening experience that really led me to like actually pursue a diagnosis was in college and graduate school. I think that one of the things that really opened my eyes to what I was dealing with was actually when I started living with other girls for the first time.
Yes, that's right.
And I was seeing the, difference between their period week and my period week. And I was like, oh, clearly something's not right here for me because they're like, maybe having some cramps on the couch for like a day or two, but going about their normal life. And it was actually one of my friends in graduate school, and she was just like, Alyssa, this is not normal. Like, you can't even eat anything during your period. I used to say that it was like my rice cake week because the only thing that I could like get down
Oh,
and tolerate was rice cakes because they
oh,
were like plain and
yeah.
simple. Um, and she was kind of like, "Yeah, no, that's not normal." And then, during graduate school, you're also learning all of this information about the body and all of this too. So I think that, between that kind of eye-opening experience and just like the more that I was learning, the more that I realized, yeah, like what I'm experiencing really seems to be aligning with endometriosis. I
Wow.
will say that during graduate school, you don't have a lot of time to
Mhm.
yourself to figure things out.
Mhm.
Um, so that's another thing that I think that like can impact diagnosis that people don't always think about is because it is a little bit of a tough road and it requires a lot of doctor's appointments and consults and tests and those kinds of things. Like if it's not the right time in your life, it could also make it really challenging to get a diagnosis. So when
And
I
it
was in
requires
grad,
so much self-advocacy. Like, you,
yeah,
as a medical professional, you are learning how to become a medical professional, almost in a sense, a little bit of a leg up for
yeah.
advocacy. Yeah,
And
wow.
that's really one of the most frustrating things and things that made me the most emotional through my journey. It was, I would have these conversations with doctors and I would just kind of leave and feel so
Oh,
disheartened because I was like, if that was this hard for me, I
yes,
can't imagine
exactly.
how hard that is for someone else because I'm going in there as someone who has a doctorate and is, specializing in a women's health field and has a lot more information than the average person. And they're still gaslighting me and still
Mhm.
telling me that my opinions and my subjective report doesn't matter. So I think that was really, really disheartening through that process. Um, but then, yeah, once I got out of school and I had a little bit more time, I was like, I'm going to get myself in front of the right doctors and I'm going to really fight for this. And, you know, I personally knew that with the information that I had, I knew that I wanted to pursue surgery at that point. I knew that I wanted to pursue it for the confirmation and also, the excision and removal of the
That's
endometriosis.
right. Yep.
Yeah, so that's the thing previously the gold standard of diagnosis has always been a surgical diagnosis, which they do via laparoscopic surgery. Some of the new guidelines, we were just talking about this before we started recording. Some of the new guidelines from the American College of Obstetrics and Gynecology are that they are now diagnosing the condition based on subjective report and
Mhm.
physical examination without having to have that confirmation via surgery or pathology, which I think is huge, for many reasons. I think that, just making people who are going through that process feel more assured and feel like that subjective report matters because half the time you're going in there and you're telling them all these symptoms you're dealing with, the pain during your period, the pain may be off of your period, pain with intercourse, excessive heavy bleeding, things like that. And they're just kind of like, yeah, well, none of that really matters until we find out via surgery if, you have it or not. So I think it gives a lot more power to those, subjective symptoms and it makes the patient's voice matter a lot more, which I think is huge.
I agree.
Um, and I think it could really help, give people more confidence if they do decide to go into surgery. Like when I was kind of going through it, you're going into surgery and there's this kind of big question. It's like, well, what if I come out on the other side of this and it was all for nothing?
Yeah, that's happened
And
to one of my patients before, where they went in and
yeah,
find it. It wasn't an actual excision specialist, though, so they had
yeah,
gone with a general provider. How did you find your provider, Alyssa? And then did you have a question too?
Yeah, I was going to ask about the things like that you heard as you're going through this journey. Like, what were doctors
yeah,
telling you as you're going in and describing these symptoms? I mean, that even as a non-medical professional, only being able to eat rice cakes for an entire week a month, that to me, I'm
Totally.
like, no, that doesn't sound
yeah.
normal.
And
Something's going on.
debilitating pain where you're in
Debilitating
bed.
pain.
Yeah.
Yes. So what is it that you
Would
heard?
say, yeah.
Yeah.
So initially, it was always, period pain is normal,
Ugh.
Ugh,
which,
Ugh!
gross.
we
Are
have
these
our.
men or women, Alyssa? Can you tell? Both?
I actually would say, like, mostly women that I
Ah!
saw
How
along
could they do
Do
the
you
this?
have
journey.
that period pain,
Oh,
ma'am,
I
Um,
know.
doctor?
yeah, which
Yes.
I'm
is
in
really
bed for a
unfortunate.
week, like,
Yeah.
believe me. Just
Yes.
believe me.
Okay, so period
Yeah,
pain's normal. Great, which is
Ah!
true, right? It is true. But period discomfort,
Yeah,
period,
totally.
yeah.
Yeah,
There's a
mild cramp.
spectrum, and I think
There's a
that,
spectrum.
there's normal discomfort on your period, and then there's abnormal
yeah.
discomfort. But another thing that I feel like was frustrating to me kind of early on was kind of being told what I did or didn't want by my provider, and at
Mm.
one point, it was kind of like, "Yeah, but, like, you don't want surgery right now, like, you don't wanna go through surgery," and I was kind of like,
Actually, I do.
"Okay, like, I don't know if I do or don't want that." Like, it
Mm.
was kind of not like, "Here are your options, you could go have surgery." It was just kind of like, "Yeah, but you don't want that." It wasn't, like, given as an option to
Hmm.
me.
It sounds like
Um,
you were going through post-op every month
yeah.
Yeah,
without the surgery, right?
that's
It's
right.
I
like, yeah.
exactly.
And I have a patient that I actually said that because they were really hesitant about doing the surgery because of the downtime after
Yeah.
surgery. And I said,
Mhm.
"You have 4 days where you cannot care for your children and you cannot get out of bed
Every month.
Yeah.
every single month.
Yeah, you
So
could do
you are
surgery like
having the
10.
surgical recovery
Yes,
every month."
without the
Yeah.
benefit.
Yes.
Yeah.
Okay, so
Exactly.
tell us about the surgery. So once you
Finding finding the
finding the
provider.
provider, and once you
Mhm.
actually got in front of somebody who was not saying, "You don't want the surgery," but actually saying, "This is what the surgery would be like. These are the pros and cons," giving you the information.
Yeah.
Yeah, so definitely a lot of, like, searching to find and also, another thing that's really hard in this process is there are not a ton of providers who
Mhm.
are specializing
I
in this.
know.
So the wait times can be really long, and that can be disheartening when you're going through this.
Yeah.
But I ended up finding, a surgeon. So when you're looking for, like, an endometriosis surgeon, kind of like you just mentioned, one of your patients went to a surgeon or went to a doctor who maybe didn't specialize in excision and they were told that they didn't have anything or they didn't find anything. And that's like a lot more common than it should be.
Mhm.
Where surgeons who are not really qualified to be identifying and removing endometriosis are doing these surgeries instead of referring them out to someone who is
Yeah.
qualified.
That's how Nancy's
But
Nook came about, right? Nancy's Nook, it
yes.
was because people were trying to find actual vetted, true specialists.
Yes. So Nancy's Nook is a great resource for finding surgeons in different, states across the world, actually. And then there's also websites like I Care Better where they do vetting, where they do like the surgeons have to send in video evidence of their, surgical techniques that vets them to, be a qualified endometriosis, excision specialist. But essentially you want to be going to someone who is a minimally invasive surgeon who does endometriosis surgery on a regular basis. You don't want to be going to your general OBGYN, kind of one of the things that maybe they say in Nancy Snook, that maybe this is where I've heard it, but like you don't want to be going into surgery with someone who delivers babies. They should
Mhm.
not be delivering babies
Mhm.
one day and then doing your endometriosis surgery the next day. You want to be with someone who all day when they are in surgery, they are doing, these types of surgeries. So that's kind of how I found what I wanted to, where I wanted to go in terms of surgery. Um, and then, I was actually, I guess maybe I'd say lucky where I got a pelvic MRI prior to surgery and I did have visible endometriosis on my pelvic MRI. That is not super common and not always the case for a lot of patients. You can have completely negative imaging, whether it's ultrasound or MRI, and still have, significant endometriosis disease. Sometimes it just doesn't show up on imaging. But once I got that MRI, it was kind of like, all right, there's no question, like we're going ahead with this surgery because, that's pretty good evidence that this is warranted.
I can
And
imagine that that would be so overwhelming for people thinking,
yeah,
they have this pain like you're a patient that
Mm,
you talked about, but I think a lot of other people as well. If there's no confirmation, if they've never had an excision surgery, they don't have a diagnosis, and then they have these imaging tests or, ultrasounds or whatever, and there's no evidence. It's like you're
yeah,
going into surgery blind. It's really an exploratory surgery and
yeah,
hoping that they find something
yeah.
that can
yeah,
improve your
Validate.
quality of life
Mm.
and validate your symptoms, but that
yeah,
must be I could imagine that that would hold a lot of people back from wanting
yeah,
to go in. Why
yeah,
is that,
and
that it
If they
doesn't
even
show
get
up?
imaging, because that until recently, that wasn't even.
Yeah, it wasn't even a
Mhm.
thing. Why is it that it doesn't show up? It's just the tissue that looks a lot like the tissue around it, or
I'm actually not sure I have a solid answer on that. I don't know if you have an answer, Alex, but I know that there are various types of endometriosis tissue and various types of presentation. So you can have endometrial cysts on the ovaries or what they call like a chocolate cyst. It's essentially a cyst that's full of blood on your
Mm.
ovary.
ouch.
Um,
And sometimes
those
it's
are
hiding. It can be behind the uterus. It can
Yes,
be in these
yes.
different. Yeah,
Mhm.
one of
On the
my patients right now,
bowels.
it's like it's in a cul-de-sac in between.
yes.
And so
Mhm.
So
that it just
sneaky.
you wouldn't be able to see it really, yeah. But then
Yeah.
there's other endometriomas that you can see and they
Mhm.
measure them. But then there's some that were totally hidden.
Yes,
Yeah,
yes.
exactly. So it does a good job hiding itself, I
Yeah.
guess, is maybe
Yeah.
the
Yeah, that's
answer
Yeah,
that
yeah,
I
it's
I
really
have.
that's correct,
sneaky.
Alyssa.
Okay,
Um,
so you had this MRI that did actually show. So they kind of had a target to aim for, at least
yeah,
knowing where they were going in. You
yes.
found a specialist who is
Yes.
very highly qualified.
Yes. Yeah, and so then I went into surgery and then kind of like you were talking a little bit before about how like nerve-wracking it can be to go into surgery and not knowing like the result, but an experience that I had, an experience I know a lot of people, a lot of my patients have talked about, a lot of like other people who I know with endometriosis have talked about is like that moment when you wake up and you're like coming off of all of these like anesthesia drugs. So you're also kind of out of it. And like your first question is just like, did they find it? Like, did they find
Yeah.
it? And like,
Mhm.
what happened? And, then they say, yeah, like they found it and they removed it. And I remember for me, like, I just like broke down. It was
Of
Well,
just that
course.
like,
Years of
relief of,
pain.
like, "Oh
yeah.
my god, for the past
Oh,
10
it makes
years,
me
I
wanna cry
I
haven't
know,
felt
me
We're gonna
too.
cry.
We're gonna
crazy."
cry
Oh my
here.
god, Alyssa. It's like all those
Yeah,
years of just
Yeah.
being dismissed, and then suddenly
yeah,
it's so validating.
and I remember my mom came into post-op and, like, I was crying, and the nurse was like, "Is she okay? Like, does she need something?" And my mom was like, "I think she's just, like, relieved."
Relieved.
Like, it was more that feeling than any of, like, the pain. But
Ugh,
yeah, so I had surgery, it went successfully, the recovery from the surgery is, challenging as any recovery is. But I think kind of like we talked about before, like when you're a person who's like pretty used to being in pain and
right.
discomfort,
Yeah, it
Mhm.
doesn't even compare.
yeah, like it, for me, I was kind of like, thankfully, like again, like with my background, I had a good idea of what to expect and how much time I probably needed off and, best ways to recover. Um, but I felt like, it it was what I expected. It took some time. I had probably 4 weeks off of working, but, as a physical therapist, you are in a little bit more of a demanding job. I always say,
Mhm.
like, I maybe could have started sitting behind a desk and working at a desk, 2 or 3 weeks out. But when you're a physical therapist, you wanna make sure that you're good to show up for your patients. So, I took a good month off to, rest and recover. And yeah, I think that it was huge in my journey. I think that another thing though with the endometriosis journey is like the surgery doesn't solve all your problems.
Totally,
And
that
I
was my
think
next
that
question,
Mhm.
is your
yeah,
lifestyle changes? Because I know there's so
yeah.
many supportive practices from a broader lifestyle. Let's dive right into that, Alyssa, if you feel comfortable just sharing the changes that you made for managing chronic illness, diet, exercise, sleep, all those things.
Can I ask
Yes.
one
Please,
question
yeah, please.
Mhm.
before? Because I'm not really, I'm not so familiar with this. So you go in, you have this surgery. After you recover, when you're back on your feet, what changed about
Mm,
your, like, how did you feel?
Yeah. Um,
great
that's a good
question.
question. And like I had a lot going on in my life at that time, so it's a little hard for me to pick out like exactly what I was feeling. Um I do like, those first few periods after surgery are not fun. It's not
Mhm.
like, "Oh, everything is better." I feel like because your body is still in healing mode, they actually can be, like, some of the most, uncomfortable and
Mm.
painful,
Mhm.
periods.
And so, Alyssa, were you were still getting a period? I have a lot of patients who are
Yeah.
total suppression, no longer getting periods
So
with
I, during
hormonal.
surgery, had a Mirena IUD inserted, and then I had about
Mm,
Hmm.
maybe,
yep.
like, 1.5 periods after before the Mirena, I guess, like, really suppressed
Yeah,
my period.
like 6 months,
Um,
yeah.
yeah, and so I ultimately ended up getting my Mirena IUD removed 6 months later because I just didn't like the way that it was making my body feel. It just
Mhm.
wasn't right for me. But I think that, you know, after the surgery, I would say the biggest thing I felt was like the mental and emotional weight lifted. The physical stuff was still there, and I
Mhm.
had a lot more work to do to
Yes,
figure
that's where
that
pelvic
out.
floor PT is so important
Mhm.
because it's
Mhm.
like we
Yeah,
remove the adhesions and the endometriosis, and then you have to retrain the entire nervous system and musculars.
yeah,
Mhm.
So it's like your whole pelvic floor is still gripping like you still.
Still have the
Yes,
pain.
exactly.
So your
exactly.
pain didn't, I mean, so the period pain, the symptoms that you were having pre-surgery, those were more gradual? It wasn't like you
Exactly.
recover and then
Yeah,
yeah.
it wasn't just, like, immediately gone after surgery, and I mean, I'm very lucky, I am a pelvic floor physical therapist. I work in a great pelvic floor clinic. So I was surrounded by a lot of amazing people to be able to help me through that. So I was able to, focus on those things and have access to pelvic floor physical therapy and, my own knowledge to help myself out. Lots of like abdominal massage work, some pelvic floor release work. All of that was really important, like physically to my body in terms of healing. And then in terms of like lifestyle, kind of shifting that direction, again, like this took time to figure out. One of my main symptoms after surgery that I really struggled with was actually the fatigue side of things.
Mm.
So that was something that I've always struggled with, but like became like really prominent post surgery. Like when I say fatigue, I mean like debilitating to
Oh,
fatigue. Like there was a period of time where I didn't know if I could keep going to work because I was so tired that I was falling asleep while I was driving to work.
oh,
Like,
Mm.
Alyssa.
I was like, "It's not safe for me to be driving." I would call my mom at 7 AM every morning to talk to her while I was driving so I wouldn't fall asleep. I needed to, like,
Wow.
have someone to talk to.
Geez, and that's like
Um,
a hallmark sign of endometriosis is the
yeah,
pain with the addition of fatigue and digestive issues
yeah.
and all that. So it's almost like then here you have the procedure and it got worse initially.
Yeah, and I don't know that it necessarily got worse or more like just it became like, something that I was more
Aware.
aware of,
So
yeah,
obvious.
um, and I think also because at the time I was starting my career and
Yeah.
I was commuting and, like, it was a different style of life. I didn't have time to take a nap in the afternoon like maybe I did in school, like, life just shifted and maybe it became more aware. I don't
Mhm.
necessarily know that, like, after surgery, that was why it got
Sure.
worse or if it was
Yeah, it
just
wasn't
Mhm.
like
kind
the
of like
causation. Yeah, I got it.
yeah, if it was just kind of a coincidence with, like, how my life shifted at that time.
I
But so
also
that
wonder
was,
if
like
as your nervous system was coming back down, like you were living on this adrenaline and fight or
yeah,
flight for so long, and then suddenly everything's shifting downward and you actually like could rest
Mhm.
yeah,
and needed
and
to.
my body needed it, yeah.
You needed it.
Um, but so, like, lifestyle, a lot of the things that I've been doing for years, even, like, pre-surgery. So I changed my diet back in 2020, and I don't eat any, like, added sugars, and for a period of time, was also limiting, dairy as well, really kind of, like, anti-inflammatory. And then gluten is actually something that I cut out a little bit more recently, and that's what I wholeheartedly believe solved my fatigue problem.
Mm.
I don't have any evidence besides the fact that 3 months after stopping eating gluten, I felt like I woke up from a lifelong slumber, like, it was, like,
That
night and
profound.
day.
Wow.
Yeah, I was
Ooh.
like, "Holy crap," and I was like, "I guess I'm never gonna eat gluten again because I don't wanna feel that tired
Yeah.
anymore." Um, so I don't eat the added sugars, I don't eat gluten, I limit dairy. Dairy doesn't seem to have a significant impact on me, so I don't have it completely cut out, but, I try to keep it to, good, like, healthy Greek yogurts and, like, things like that. Goat cheese, all of those kinds of things. And then, like, exercise, activity, like, that's something that can be really hard to navigate with endometriosis and post-surgery and chronic pain in general because and when your nervous system is upregulated because you wanna be staying active and finding movement, but you wanna be respecting your body and finding the ways to do that, that your body wants. So you
Yeah.
wanna do at first, I was definitely doing more low impact stuff, I was walking, I was trying to get outside and walk, but I was doing more like yoga, breath work, stretching, those kinds of
Mm.
things.
Like
Um,
pacing, really pacing. We talk a lot about pacing and
yeah.
periods of rest and periods of
Mhm.
activity. Wow. And so were you utilizing your persistent pain and cognitive behavioral sort of knowledge for pain management and in all of this? Because I just keep coming back to the pain science and what we
Yeah.
as physical therapists learn about that. Did you find that you used it for yourself?
Yes, I definitely think that that was a huge part of it for me post-surgery as well, and I even, like, took it a step further and I was like, "I know that there's a chronic pain, central sensitization
Yes.
situation happening in my body. I need to break this pattern and break this pathway." So I
Alyssa,
actually
could you, for the non-pelvic floor physical therapists out there, can you just say, just a little bit about what that is?
Yes, and there's a
yeah,
central sensitization questionnaire that I do with
Mm.
all of my patients who I believe may have it, and you can
yeah.
find it online. So somebody could do it and score it and see where they.
So what does that mean, central
Yeah,
sensitization?
Yeah, so essentially it's like this the role that the nervous system is playing in the pain pathway. And when your body is subject to chronic, like long-term pain. So when we think of chronic pain, that's anything that's like, you know, I forget if it's 3 months or 6 months
yeah,
more of
mhm,
pain.
yeah,
Mhm.
But that pain
sure.
is like long
Lasting.
lasting.
Mhm.
And we can also classify it as like there's not necessarily a physical ailment or injury to the tissue anymore. The pain is coming from the nervous system and the signals that your body is sending to your brain,
It's
versus
like
a true injury.
you're burning the
Mhm.
toast and every fire alarm in the house is going off.
Mhm.
So,
So the
Exactly.
yeah.
pain is very real, but you
Yes.
can't point directly to a wound or an injury that's still active?
That's right, and Lorimer Moseley
Yes.
uses this analogy, which Alyssa, if you
Yeah.
don't mind, I'll say. Well,
Yeah.
a story rather. He was walking in the Australian
Mm.
outback, and he thought he got scratched by a stick. He was bitten by the most venomous snake. He woke up 3 days later in the ED. He nearly died. 3 years later, he was walking with his friends in the Australian outback. He had the worst, most searing pain of his life. He fell to the ground, clutching his leg, and he had been scratched by a stick, and he wasn't even bleeding.
Hmm,
And he was like, that pain was so real because the
totally.
body wants to protect you. It's
Right.
just trying to protect you. So first it will let you get, 3/4 of the way up the mountain. Then it only lets you get halfway up the mountain before it starts screaming. Then you're only getting a quarter of the way up the mountain. And you're not injured yet.
Mhm.
But the body's like, oh, I remember this. I remember this. I don't want you to do that again. It's like,
Mhm.
don't worry, I'll save you. But then it gets into this broken record.
That's so interesting because one of the things that you said, or maybe I said it in my mind as you were talking about the surgery recovery, I'm like, oh, well, you've been living with this chronic
Yes.
pain for so long, that the recovery from the surgery, it's like, oh, okay, that you're used to pain. But
Yeah.
actually, it's like when someone gets used to pain, their nervous system can almost work against them. They're more sensitive,
Yeah.
even though they are used to living with a certain amount of pain. It
Yeah.
doesn't actually give them a higher pain tolerance necessarily.
No, and it's like the body keeps the score. You know what I
Yes,
mean?
Yeah.
So it's
yes.
that memory, it's the body's
The
memory.
toll.
Yeah, totally.
Yes. Okay.
Yeah. Exactly. So that's kind of, the basis of it,
Mhm.
and
So
it
you
is
knew that you
tricky.
had this going on in your
Yes.
body. Yeah.
Yes. It is tricky with something like endometriosis though, because there is potentially still some inflammatory processes and some injury that, systems that are going on in your body. But then there are also like a bunch of other things that are triggering pain that maybe aren't related to that. So,
Mhm.
for a good example that I can give that I was noticing myself is I was having a really hard time wearing jeans because any pants that put pressure on that area of my body, that like lower abdomen, like pelvis, like even if they weren't, like, tight, if I was sitting in them and the
Mm,
pressure was there, it would elicit this pain pathway, and I
mm.
would suddenly be in, like, a full blown pain flare. And so, like, that's a great example of, like, how something that is not an injury
Benign, right?
or
I know.
damage
Yes.
could create this, like,
Mm,
pain, pathway in response. So I actually went to a, clinical psychologist who specializes in pain management,
mhm,
and I don't even know how many sessions, but I did a few months of cognitive behavioral therapy with
mhm.
her to work on, reversing that cycle. She was
Wow, that is
also
so
really
cool.
helpful, just in terms of, like, the mental and emotional management of chronic illness. She also,
Mm.
I think, was really helpful just, like, in navigating that. But we did a lot of, the I don't know if I'm sure you're familiar with it, Rebecca, but it was more like ACT therapy based,
Mhm,
so like
mhm,
acceptance commitment therapy.
mhm.
Like you're going to have to accept like the feelings and the sensations in your
Wow.
bodies. Like you can't
Okay,
just
I'm
like
not familiar with this. This is so
think them
great.
away.
Mhm.
Okay.
Um, but it's very value based. So your goal is to always like shift your attention to your values. So like if I started to spiral down like a pain pathway, you know, the goal would be to acknowledge and notice like what it is that I'm feeling in my body and kind of lead with curiosity versus negativity.
Yep.
So like immediately when you feel pain, you want to like be like negative, like, this is a negative feeling, but it was kind of more like, how can I shift my mindset to more curious of like, like, what is my body feeling and where might this be coming from? Oh, like maybe it's coming from, the button on my pants. And just kind of being curious about it and not letting it have like a super negative association.
Oh,
And then wherever you are, whatever you're doing, shifting your focus and your attention to something that falls within your values. So if I was out to dinner and started feeling this, like whoever I'm with, whether it's my partner or friend, like okay, like my value here in this moment is to be present with this person that I'm with, and I'm gonna shift my focus to them and not let this pain that's, this car alarm going off take over and drown out what they're saying to me.
wow,
Um,
Alyssa, this is
Mm.
so wonderful.
Mhm.
so it's very powerful and the impact. A book that I read with that therapist was called The Way Out by Alan Gordon. So he did a lot of like chronic pain science research. His work is all more specifically on low back pain, but it can apply to any chronic pain anywhere in the body. I recommend that book to a lot of my patients who are dealing, with chronic pain or my endometriosis patients. So I found that to be super helpful, but it really was helpful with work too because, when I was at work, if something started to
Mm.
go awry in my body, there are times where you're like mind starts to spiral and you're like, do I have to go home? Like, am I gonna be
Oh,
able
of
to show up for
Mhm.
course,
my
totally.
patients? Like, it's important that when I'm in a session with a patient that I'm 100% present for them. But I would kind of use this technique and, you know, say to myself, I really value my job and like I really value caring for other people. That was probably one of my biggest values in life is like to be able to care for other people and kind of shift that mindset towards, this is really important to me and who I am. So I'm going to focus on that right now. And I'm going to be aware and acknowledge, and I'm not going to, be mad and angry at the pain that's there. I'm just going to let it be. And then I'm going
Mm,
to focus on this.
wow.
And
Um,
wow,
so that was really a big thing for me in terms of pain management was that side of it.
that's huge. Okay, so
You gonna ask about the
I got
relationship?
to.
I know
I
she
got
is.
to. I
Yes,
got
this is
to. So I got to ask about this is all this management of this condition is all encompassing. Like it's affecting everywhere in your life. So what do you see for your patients if you're comfortable sharing? What did you see for yourself? How does it affect your relationships? What about sex? What do
Yeah.
patients report? How do they have a normal, you know, pleasure-based life when
Yeah.
they're having so much chronic pain.
Yeah. No, I think this is a great, question and topic to cover because I think it's a huge part of like what so many people dealing with endometriosis have to work through. And one of the most common symptoms of endometriosis is pain with
Mhm.
intercourse. It's one of those hallmark symptoms of this condition. So it definitely can, play a big role in how it impacts your relationship and your
Yeah.
intimacy. I think that on a very like physical level, just kind of starting there, you know, if you are dealing with pain with intercourse, whether it's a result of endometriosis or not, I think that what I always encourage my patients and have found myself is the most important thing to navigating it is that communication with your partner. I
Mhm.
think
Oh,
that you have
totally.
to have
Mhm.
that open line of communication with your partner about what it is that you're feeling on a given day, I think that in terms of endometriosis, there can be very cyclical patterns of pain throughout the month, especially if you are getting, a regular cycle or a regular period. So it might be a matter of, working with that knowledge and knowing your cycle and knowing what time of the month where you tend to get your pain versus time of the month that you don't tend to have as much pain. And, I'm a big believer in, if you have to schedule intimacy with your partner, like schedule it.
Mhm, totally.
um,
Especially for
and
it to be more successful and
Oh,
pleasurable and
yeah.
fun and great.
Mhm.
yeah, so using that, that knowledge to help, make yourself more successful. But I think also, what's really important is taking, and I'm sure I know you guys have, hit on a lot of this as well in other episodes, but society is so focused on that like one type of
Oh,
intimacy
so true.
being, penetrative
Preach, Alyssa,
intercourse.
preach.
And I think there's just so many ways to create intimacy with a partner beyond that. And even when you are maybe in a higher pain day or, you're uncomfortable, there are ways to, create closeness with your partner that don't involve that.
Mhm.
Whether it's just like cuddling or maybe you need a back massage or a back rib to help with the pain, or maybe it's like a really good conversation,
Right.
in you're like cuddled up in bed. Like those things I think are really important too.
And intimate, yeah.
Um
Mhm.
yeah, I'm really lucky because I've been in a very, like, healthy and in a relationship that I've been able to navigate all of this in. It's not easy. There have been times where, you know, I'm like, "I'm 25, like, why is this so hard for me? Like, this
Yeah.
shouldn't be how it is. It feels
Ugh.
unfair." But I have been lucky to be with someone that I can communicate with and, that is very understanding of what I'm going through. Um, you know, I do feel like I've seen with patients, sometimes it can be not as ideal of a situation if you have a partner that maybe isn't quite as understanding or a partner who is pressuring you into doing things that you're not comfortable doing at that time, or you're like suffering through a certain position that's really painful for you. That's another thing I felt like, just like from a PT perspective, you know different positions have different amounts of, depth and penetration. So that's another thing you can play around with in terms of intercourse is, finding the positions that are comfortable for you.
And I love the
But
O-nut for that too. It's this, like, stretchy
yeah.
silicone it puts
Mhm.
on, you might
Mhm.
know it too,
Mhm.
but for folks
Yeah,
who are
that's
looking
great. I've
to
used that
control the depth.
product.
Mhm.
I think that it's really great.
I do too.
Um, but
Or you
yeah, and I
doing,
think
like, vibratory therapy beforehand. There's a lot of strategies.
yeah.
Pelvic floor PT, I think, is a really good
Mhm.
place for this part of the endometriosis care specifically.
Yes. Yeah. And I think too, like just like the emotional toll that chronic illness can take on you can also really impact a relationship, So I think that can add another layer on top of just like the physical side of it. And I know you guys have talked a lot about like desire and like response and arousal and all of that. And like when you're in pain or you're in this like state of like being heightened in your nervous system, like desire and like arousal is not the first place that your body goes.
Mhm.
So there might be times where that like libido or that like arousal is lower, and that's okay. Like I think that that's also something that's important for people who are going through this to understand. And again, like a lot of people who are going through this are maybe, younger and, in their 20s and they're like, "Oh, like everyone always says that like your best sex is when you're in your 20s and then you're whatever."
Yeah.
It's not
But
No,
true.
it's
It's
not
not true.
true.
It's
It's
not
not
true.
true. No.
but I think that it's, also just like emotionally allowing yourself to be okay with like, you know what? Like if I'm not feeling it right now, that's probably because my body needs something else right now.
Yeah.
Mhm.
And I think that working through the emotions of that, is challenging but important.
Yeah, it's
Um,
Mhm.
self-acceptance, it's honoring your own needs, it's
yeah,
Mhm.
actually respecting yourself in a lot of ways, yeah,
Yeah,
and that
yeah,
totally reminds me of the wheel of consent that we talked about,
for sure.
It's just really being true to what you actually can say yes to
Mhm.
and want to, and
Mhm. Yeah, and so much of that, like you're saying, I think the really important piece is that communication.
yes.
And
yeah,
if someone's not sure what's going on in their own body and it's sort of a mystery,
Oh,
then
yeah, it's
then
hard
it
to
gets
advocate.
really hard. It's
Mhm.
hard to advocate, but what I see so often, and I know that you guys do because I refer to you whenever I see somebody who's having this, is that you do have that pain pathway that can show up with sex and with
yeah,
penetration. And so,
mhm,
a lot of times people think, let's just power through.
Oh,
We just got to
yeah,
power
and it
through. And it really does get
perpetuates
that.
the pain
Yes,
cycle.
it
Mhm.
does. It
yeah,
does. And, it's not satisfying for the partner
Mm-mm.
either. This is not a situation that anybody wants to be in. But I think so many people find themselves there and they don't know where to go. They don't have the information. They feel like there's something wrong with them and they don't feel like there's another option. So I really appreciate what you're saying, Alyssa, about all of the different, the communication and finding things that are pleasurable, whether it's sexual or whether it's more like physical and emotional intimacy with your partner.
mhm,
I think that is something that when people come to see me with these sorts of issues, that's what we work on. We work on the communication. We work on trying to find those ways that they can still be intimate and find pleasure together. And sometimes that is, getting really creative. And sometimes intercourse is not something
Yeah,
that,
taking it off the table, yeah.
yeah. And
Mhm.
and honestly, unless you're trying to conceive,
Right.
mhm,
it's just not as
yeah.
important as the emphasis that our culture puts on it if it's not pleasurable.
Yeah. And I think that, as challenging as all of this has been for me to navigate and for so many people in same, similar positions to me, I do really think that it can actually like build a relationship
Mhm.
so much stronger. Like I see my relationship with my partner and I'm like, we are stronger because we've been through this. Like,
Wow.
you know,
Mhm. Well,
it
you've had to
has
communicate.
You've
You've
had to
had to
communicate,
yeah,
talk
no choice.
in ways that sometimes other folks
Get away with
haven't,
not.
and
Mhm.
then those
yeah.
those communication skills, they translate everywhere.
Wow.
Yeah,
Mm,
exactly. So
Oh
I
my
think
that's a
that
gosh.
really hopeful
that's
perspective.
that's the
Mhm.
silver lining. The silver
Yeah.
lining in it is, it has made us better and stronger. But it's not easy. It doesn't make any of it easy. And, I think that's something that I've described in this, is, you kind of like grieve this idea of like who
Mm.
what your body like what you wish your body was, or
Mhm.
it can, when you're dealing with something like this, it can really make you feel super distrusting of your own body.
Mhm.
And there have been times throughout this journey where I've almost felt like dissociated from my body because I'm
Mm,
just like, oh, like I do not want to be associated with
totally.
that.
Yeah, you wanna get out of it.
um
Get out of here. Yeah, totally.
yeah. But I think that when you can work through all of those feelings and come back to yourself and honor and respect yourself, I feel like what I say to my patients, like going through all of this stuff is, give yourself grace. Like you're going through a lot. Like you really need to give yourself some grace. And I think that again, like it can make you really strong on the other side of it.
Mm,
Wow, and wise beyond your years, Alyssa. This has
yeah.
been such an incredible conversation. I think one of my favorites we've had so
Yeah,
far.
really, it's been such a gift. So,
Yeah,
Well,
this
we
is
thank
really
you so much
appreciate
for
it.
thank
having
you,
me.
Alyssa. Oh my gosh, you are just a
Mhm.
wealth of knowledge. Thank you.
Thanks for listening to Under the Hood. We hope you enjoyed this episode.
Please like, share, and subscribe.